Take a close look at your chest, your neck, or maybe your face. You might notice a tiny red mark right at the surface of the skin. It looks like a miniature spider web, and if you watch closely, it might even pulse slightly in time with your heartbeat. This mark is called a spider nevus. Doctors use a physical test for these anomalies. Press on the center and the web disappears. Release and blood instantly refills the structure outward, flooding from a central arteriole into tiny surrounding vessels called telangiectasias. These marks almost exclusively appear across the upper body, the upper trunk, arms, neck, and face. This geography matches the area drained by the superior vena cava, tying their presence to the hydraulics of this vascular zone. This combination of unique geometry and specific location suggests that the occurring within the body's internal environment. Finding one or two of these red webs on your skin is not necessarily a cause for concern. By themselves, isolated spider nevi often appear in healthy individuals without indicating any underlying disease. In fact, it is normal for up to 7 of these lesions to appear in young people, in pregnant women, and patients currently taking oral contraceptives. In these cases, they are simply a benign feature of the skin. This creates a diagnostic paradox. The same physical mark can be a harmless biological quirk or a sign of severe internal dysfunction. To understand exactly why, we have to look at the specific chemical that forces these vessels to dilate. If we move beneath the skin and into the bloodstream, we find the primary driver responsible for these marks, an excess of circulating estrogen. As high concentrations of estrogen molecules accumulate in the blood, they act directly on the vascular walls, causing specific, delicate vessels to dilate. This creates the visible central hub and radiating legs of the nevus. A comparison line graph then shows that pregnancy and birth control pills introduce expected temporary spikes in estrogen. The body reacts to this temporary hormonal increase by dilating a few vessels, which is why a small number of nevi are normal. But if a patient isn't pregnant or taking hormones, and particularly if the patient is male, that sudden flood of circulating estrogen has no natural explanation. It suggests that a major organ has stopped regulating the body's chemistry. That failure points to the liver. While the liver is essential for digestion, it also serves as the body's primary chemical filter, responsible for breaking down and clearing sex steroids like estrogen from the blood. This flow model contrasts a healthy liver against one with cirrhosis. When heavily scarred, it loses filtering capacity. Raw, unbroken down estrogen bypasses the filter and floods back into circulation. This unfiltered estrogen travels upward and pools in the region drained by the superior vena cava. It saturates the upper torso, putting chemical pressure on the vessels until they dilate under the strain. In this context, the spider nevus is a visible distress signal, a surface-level indication that the liver is failing to clear hormones from the system. Because these marks can appear in healthy people, doctors use a strict quantitative threshold to identify high-risk cases. This is known as the Rule of 5. This meter illustrates the clinical boundary. Finding between 1 and 5 spider nevi is often a normal baseline for many people. However, when a patient presents with more than 5, the count becomes clinically significant, pointing toward chronic liver disease. This rule is especially critical for men. Because men naturally maintain very low estrogen levels, the appearance of these marks is a glaring indicator of a systemic failure to process hormones. Quantity dictates the diagnosis. Crossing the threshold of 5 shifts the clinical focus from a simple skin observation to the management of severe liver dysfunction. A spider nevus rarely appears in isolation during advanced disease. It is usually part of a constellation of signs, including palmar erythema, a distinct reddening of the palms, and jaundice, the yellowing of the skin and eyes. When these signs appear together, they allow doctors to distinguish chronic liver disease from simpler issues like a blocked bile duct. The combination of red palms, jaundice in the eyes, and a cluster of spider nevi provides a clear path to a diagnosis of cirrhosis. The skin serves as a diagnostic interface for the organs beneath it. While a single spot might be a quirk, a cluster of 5 red spider-like marks is the liver's direct way of signaling a severe medical emergency.